Hi guys, welcome to Nurse Minute Scoop. Memory tricks in a heartbeat. Today we're going to be talking about UWORLD nursing, and this is real talk of its pros and cons. First of all, I just want to get it out there. This is not a sponsored review. I just want to help out those students or people that's going to take their board, which one will help them throughout the process. So first, let's talk about the pros of UWorld. So the one of the pros of UWorld is their pass rate. An average of QBank that's 56% or higher, their pass rate is 92.2. And for the QBank that averages 56 or higher with very high result, and a self-assessment exam, their pass rate is pretty much 96.4. And this is only good for people that's taking the board exam the first time. And another pros about it is that it's content worthy. If you're going to use this study tool, you will learn about it, the just facts of disease process, diagnosis, all those stuff. It's really helpful, especially if you're at school. That's another pros about it. Usually when you're at school, they are very deep, like they talk about from like everything that's visible to everything that's non-visible. So for students that's wondering what's the best tool for them during school, it's definitely UWorld. It's parallel to the exams that they give you at school. It's very focused. It's really good for students that want to learn ahead also for nursing, because if you are like behind in system process, they usually talk about it in depth, and it's like you will feel like a doctor while studying this because it's too much content. Again, when you're a student, it's really good for you because it gives you everything that you needed. So what are the cons about it? The cons will be the price. Compared to other nursing study tool, the price of UWorld is pretty up there, at least like I'd say almost double the other prices for other resources. I want to give you a heads up that like during my school time, some people they even like use it with other students, like divide it, share passwords and stuff like that, but I don't think it's good. Yeah, it's hard because the price is up there, but if you really want to study it and learn the content throughout the time that you're a student, I don't suggest you share because you won't learn. The better way to learn is if you read their rationals over time, and over time, as much exposure you get, the better you will learn. You can always go back and renew it, but for an additional price, and it's gonna be up there. As a nursing student, nothing is cheap, right? And on top of other resources, you pay over and over and get more price for what you want to learn. But yeah, it's another cons for UWorld is it's overkill for NCLEX. Like I said a while ago, one of the pros is it's good as a student because you learn as you go and you retain the topic. But when it comes to NCLEX, it's really overkill. Like if you use this to study for NCLEX alone and you're behind, you weren't paying attention during lectures, and you're totally like, as soon as you graduate, you're like, I don't know crap, then yeah, it's not going to be beneficial for you. I mean, it might take time for you to learn a lot of the stuff that they're learning because they're so in depth. Like one question comes with like a paragraph or like a paragraph or two or of rational. Although the UWorld comes with good pictures and diagrams, that's another pros that I forgot to mention. It does come with really good pictures, diagrams for students to learn specific disease processes. But again, the freaking rational is just overkill. So if you're going to take NCLEX and you're going to study and use this resource for people that's overthinker and very analytical and like just laid back all throughout nursing school, I really don't suggest this because NCLEX is not like that. NCLEX is not that deep in depth as how UWorld tests you. It's also dependent on what kind of student you are. If like let's say for example you will study like a little bit here and there, and then you will use those resources sparingly and not overdo it, it might work for you for NCLEX, but I really don't suggest it because NCLEX is not that deep and in that when it comes to like asking questions. It's really like, I'm not gonna say basic, but more so of like straightforward. It's gonna talk about patient safety, how you deal with your patients, like are you going to be a safe nurse and stuff like that. For those students that's postgraduate taking the board, don't use it. Try to find another resource that's going to focus on delegation, prioritization, instead of in that content that's not going to benefit you throughout the board. Yes, they will ask you here and there, but they will really go in deep. Like they're not going to ask about Redmond syndrome and stuff like that. They're more on going to ask about basic diagnosis. That so for NCLEX, I don't suggest you use UWORLD. Okay, you it's good as a student, but not when you're going to take the board. It's not like some crash course that you can take, because it's going to be like overkill for you, and it's not really going to help you unless you like half-ass studying it. Then it's fine. But for those students that are serious and want to pass the first time, good, use this as a student while you're at school and learning everything that the school tests you, because they usually test you weird stuff and questions, but not with the NCLEX. And they're pretty much updated for a Nextgen UWORLD changes that's going to be for NCLEX RN and NCLEX PN. So they're pretty prepared. So those are like additional payments on top of like the regular NCLEX RN that they're providing. And that's it. I hope you find this video informative. Thank you for watching. Please hit like, share, subscribe to my channel, and hit the notification bell and comment down below for more of videos that you want to see here. Thank you for watching. Bye.